Hello, this is Group 8 for Resistive Exercise Theory and Practice. In our group, we have Krisha, Cynthia, and me, Abby. We wanted to do our project on the deficit reverse lunge. For this, you would need an elevated platform, like an aerobic stepping platform that we'll see later in the video. And for progressed versions of the reverse deficit lunge, weights, bars, and altered versions can be conducted. To get us started, the primary muscles activated during this exercise are some of the core muscles highlighted here that are engaged to help keep that balance you need when in motion. We then have our glute muscles like the gluteus maximus, our quadriceps like the rectus femoris and vastus lateralis, and last but not least, the hamstrings, otherwise known as the biceps femoris. When incorporating this exercise to a program, deficit reverse lunge is a progression from the standard lunge, so make sure that the client can perform the standard lunge before introducing the deficit reverse lunge and its variations. One thing to keep in mind is that when the client steps down to perform the lunge, you want to make sure that the knee is not collapsing inward or outward, and immediately stop the exercise to correct the position. Having a neutral spine is also important so the client does not injure themselves, and having the client keep an eye on where they are stepping onto the platform, as they can hurt themselves if they are not paying attention. Now you want to begin standing on the platform with both feet on top, then slowly step back and lunge down into a comfortable range of motion while keeping a neutral spine and appropriate posture. Then slowly come back up with both feet on the platform. In the article about the deficit reverse lunge, it talks about the different progressions of deficit reverse lunges and their benefits. It talks about how the addition of the step to the movement will help the client achieve a deeper hip flexion during the lunge. Adding weight, such as holding dumbbells on both hands, would challenge the hip mobility in addition to recruiting more of the gluteal muscles. This helps open the ability to put more load and stress, which results in greater adaptations. Another progression would be adding a weighted bar and placing it behind the neck, just above the shoulders. Because of the load distribution, there's an increase in demand on the abdominal and lower muscles. According to Gentile's taxonomy, this exercise is considered a 3A in motion regulatory condition with no intertrial variability. This means that exercise being performed requires the body to move or be in motion. There is no change in the execution of the exercise from one attempt to the next, and there was no object being used, of course, when there aren't progressions being conducted. The deficit reverse lunge can be useful for most athletes to help progress balance and mobility training. Sometimes for runners, it's also useful to people who suffer from knee pain such as arthritis. Like we mentioned. Thank you for watching. This was Group 8 for Dr. Eminette's Resistive Exercise Theory and Practice course.